Good afternoon and thank you for this conference. This time I want to explain about how to enhance the HIFU effect, especially focus on uterine disease. And first I want to talk about sonazoid. Sonazoid is a contrast enhancing ultrasound agent, and this is basically air bubble. When this air bubble exposure to high field is suddenly blow out, and this make cell membrane damage. Think about the HIFU effect. HIFU effect is main effect is coagulation necrosis by high temperature, and the other effect is cavitation. This cavitation make cell membrane damage. I'm sorry. Yeah. If we use CUS agent like sonazoid, this microbubble can make more cavitation. So if we use CUS, and this make more cavitation effect. So this make more hype effect. But why sonazoid? We are familiar with Sonovius. Sonovius have a relatively long history agent, but Sonovius suddenly disappeared through the lung. But sonazoid is originally invented to detect hepatocellular carcinoma. So sonazoid first go to the liver, especially liver Cooper cell, and then go to the lung and disappear. So sonazoid remain in the body for a long time, relatively. In my experience, we can HIFU effect, enhancing effect is we can enjoy about 2 hours. After 2 hours, the effect is suddenly disappear. But 2 hours is very enough time to treat uterine fibroid or uterine adenomyosis. This graph is body concentration rate during the time. Absolute safe time is 30 minutes after injection. And we treat uterine fibroid or uterine adenomyosis, in my experience, about 10 or 15 minutes is relatively safe time. So when I treat uterine fibroid, I usually treat after 15 minutes. But when I treat pancreatic cancer, I always obey 30 minutes because when treat pancreas, I always worry about small bowel injuries. So obey 30 minutes. And when treat breast cancer is usually close to skin. So I worry about skin burn. And that time I also obey the 30 minutes. And sonication power for uterine disease, sonication power is usually use 100 watt to 250 watt. This is very relatively low power. I have been studied sonazoid to treat uterine fibroid with study with Chongqing University. And this study, we can significantly reduce hypersonication power, and also we can reduce sonication time. And always we can see the massive grave scale change. Sometimes we cannot see massive grave scale change, but when we use sonazoid, always we can see the massive grave scale change. So we can reduce the sonication time and sonication power. But this means we can treat with more safely. So we can simplify the protocol I always don't do bowel preparation or skin preparation. So we can treat with quickly and simply. And second is rectal poly. When we put poly catheter in the rectum and inflation the poly balloon, we can get many benefits. First, when we treat uterine fibroid or adenomyosis, sometimes the region is located in posterior wall, and sometimes the uterine position is retrograde. Retrograde posterior wall region is hard to treat. Sometimes the region is too far, so therapeutic distance cannot touch. In that case, we cannot treat. In this situation, we put the rectal polyballoon on the rectum and inflation polyballoon, and we can change it, the retrograde to anterograde. So we can treat it easily. And we can squeezing myoma. We are familiar with chemical contraction. When we treat uterine fibroid adenomyosis, usually we do treat with oxytocin. When we treat with the polyballoon, we can squeeze mechanically squeezing with chemically squeezing, make more squeezing. And we put the balloon on the rectum, and we can make some distance from sacral area. This makes more safe to nerve. And the polyballoon can reduce uterus to the anteriorly. If we reduce uterine, if we put down the uterus, we can more easily push away the bowel. So we can protect bowel more effectively. Please see the ultrasound image. The left one is the posterior located uterus, and we put the balloon inflation, and we can change the position, retrograde to anterograde. And we can see the bladder. We can inflation bladder, and usually we put the abdominal balloon inflation, and posteriorly with the polyballoon inflation, these three balloons make squeezing. And so this squeezing leads to vascularity, and so we can more effectively treat. Usually, I use 2 or 3 balloons. Each balloon, I inflation about 50 cc. In my experience, 60 cc is sometimes blow out, so 50 cc is safe and effective. And if we put one balloon beyond the recto-sigmoid junction, it's much better. Yeah, please see the case. This case is a simple case, so I want to challenge extreme low power. This uterus is, this case is a 36 years old woman, and she got the menorrhagia, so treat with HIFU, and diameter is 5.6 centimeter. This case is very good for HIFU. But a little bit difficulty is this uterine fibroid uterus is located somewhat posteriorly. When this situation, we inflate the bladder and abdominal wall balloon wall inflation. More inflation make the uterus more posteriorly, and more close to the sacral. this sometimes make difficult. So please think about if we put the balloon on the rectum, this balloon make the uterus wall anteriorly and strongly fixed, so this uterus never gonna push back to the posteriorly. This image is during HIFU therapy, and we can see the posteriorly rectal polyballoon and bladder, and anteriorly abdominal water balloon. These three balloons strongly squeezing, and always I treat uterine fibroid. I always using sonazoid. This sonazoid and rectal polyballoon make much effectively. So I can treat with extremely low power, 50 watt. It's very low power, and sonication time was 462 seconds. If we wanted to treat more short, yeah, sonication power increase about 100 watt. Yeah, it will be reduce the sonication time about half. This image is the next day sonogram image. We can treat effectively all the tumor. So in my opinion is if we treat with sonazoid and rectal polyballoon inflation, we can treat more effectively, and also we can reduce significantly the power and energy. So this makes more safe procedure. So my recommendation is using sonazoid with using rectal polyballoon and treat with uterine fibroid or adenomyosis. Thank you.
Thank you. So are there any questions? Dr. Silva, I think. So please, Jordi.
Hello. We used the other contrast enhanced is SonoView. Which is the difference between both contrast? I don't know, because SonoView is microbubbles, the same as Sonazoid. But what is the difference between one and the other? But it seems more effective with Sonazoids. The treatment with Sonazoids seems to be more effective than with SonoView. And okay, in this case, you are treating with a very low power, 50 watts. For a fibroid is very low power, and okay, impressive. Can you explain this?
Yeah,
because in Spain it doesn't exist. It don't exist. Doesn't exist the contrast. This Sonazoid. I don't have. I cannot use.
Yeah, I have experience with the SonoView, Sonazoid, but SonoView, the effect is very short.
Yeah.
And yeah, so it's
but the difference is only the longer time is the the difference is only the time it's acting the Sonazoid.
Yes, when we
more time, yeah.
Yeah, well, in my experience, yeah, SonoView, sometimes it need many times injection during the therapy, but Sonazoid one time,
yeah,
during one time, lasting 2 hours is very effective.
Is the only difference? Yeah. Okay.
Are there any questions? You.
Yeah, Kim.
Yeah.
We do simulation before we do the procedure. If you are going to do a Foley's catheter, do you do it during the simulation, or you just don't do it and do it straight away during the treatment? Do you understand what I'm saying? Do you do a simulation with a Foley's catheter as well?
You mean
say before performing HIFU, I usually test to see whether the patient is suitable for HIFU. I call it a simulation. That means a testing. And if you're going to do Foley's catheter, do you do that during the simulation as well, or only during treatment? You understand what I'm saying?
Yeah, you mean before HIFU.
Before HIFU simulation,
yes, patient to write down bad simulation.
Yeah.
when I was beginning time, I do that. But
Okay.
nowadays, I don't do that.
Okay,
Yeah.
you're quite comfortable. Okay. I mean, we all learn our HIFU from Chongqing. They taught us how to do it. How did you come up with this idea of using Foley's catheter, sonozoid, and low dosage of power? Is it your own creation? How did you come up with this idea?
Honestly, Sonazoid, I learned from Japanese doctor, Dr. Okuno.
Okay.
Yeah, Sonazoid is Japanese drug. Yeah, so learned from Dr. Okuno. And Dr. Polly, yeah, it's my idea. Yeah.
One other question is, when I learned how to do HIFU with the Chongqing doctors, they always tell me that if you do the ablation in the presence of SonoView, you will get a very good grayscale because you have that bubbles there. And that is actually a false grayscale. It's not a true grayscale. You understand what I mean? And it's quite true. When the SonoView wears off, that grayscale I don't get. So I'm wondering whether you have done so many. I'm wondering whether the Sonozoid's grayscale is a true grayscale or not. You understand what I'm trying to say? Is it reflected on the MRI contrast after the treatment? It must be, because that's what you're doing.
Yes.
You understand what I'm saying?
Yeah, I'm saying, yeah, pulse grayscale change. Yeah, you worry about it's not real.
It's not real, right?
Yes.
Right. Is it,
Yeah, it could be, but in my experience, Sonazoid grayscale change always real.
real?
Yeah, real. Yeah, I cannot say why Sonoview make pulse, why Sonazoid make real. I don't know why, but in my experience, more than 3,000 case, yeah, it's real.
Okay. Another worry that the Chongqing doctors tell me is that when you have bubbles in the skin,
Yeah.
it may cause ablation in the skin. That means you can have fat burn, you can have skin burn. Do you face that problem with Sonozoid? Or it's because you're using low dose?
Yeah, sometimes I worry about skin burn, especially breast. Yeah, so when I treat breast, I always 30 minutes. After injection, 30 minutes is safe. But in uterus, about 10 minutes is good, safe.
Why is that? Is it because you want the bubbles to disperse before why do you need the 30 minutes? And why do you need the 15 minutes?
Yeah. Yeah, this graph,
Okay.
people 30 minutes, the concentration rate is high. So in this time, people 30 minutes,
It becomes
yes,
lesser.
skin have many air bubble, but after 30 minutes, skin or the other side, the air bubble rate is very low. But in HIFU field, that small concentration air bubble is enough. So safe.
How do you explain your short time of ablation with Sonozoid? We usually take 60 minutes, maybe 80 minutes or 1 hour to do a fibroid, but your timing is much shorter, you said, with your Sonozoid. Why is that so? Because you get a faster grayscale change? Is that the reason? No, the reason is when you don't use Sonozoid,
yeah,
the power is higher,
yeah,
and the duration, the time you take to treat is also longer.
yeah.
Why is it shorter and faster with Sonozoid?
Because of cavitation.
Cavitation.
Cavitation effect. Yeah.
And do you have the same results in in fibroids with high vascularization compared to fibroids with medium or low vascularization, is the response is different with Sonazoid in one type of fibroid and in other types of fibroid?
Yeah, I'm sorry. Yeah.
Yeah.
So
Yes.
Vascular fibroid. Do you get the same kind of effect with vascular fibroid compared to non-vascular fibroid? You know, sometimes we don't do vascular fibroid.
Vascular.
Vascular.
High vascular.
High vascular. Yeah.
Yeah. Yeah. Sometimes we meet very high vascular. Yeah, in that case, it's very hard to treat with HIFU. In that case, usually I treat with pre-HIFU embolization. The embolization is not total embolization, it's a partial embolization. We think about the liver cancer, hepatocellular cancer. When we treat with hepatocellular cancer, when the cancer located in left lobe tumor is very easy to ablation, but located right lobe or hypervascular, and that time always protocol is pre-HIFU, TAC, and HIFU. Yeah, uterine is almost case is easy to ablate with HIFU sonication, but sometimes very hard to ablation, and the case is very hypovascular case. In that case, pre-HIFU embolization very effective. And next time, I will show the PPT with the pre-HIFU embolization. Yeah.
One more question.
Yeah.
When you start ablating, say a fibroid,
Yeah.
how do you increase your power? Do you start with 50 and then move on to 75 and 100, or you start with 100, or you depend on your grayscale change?
Yeah. With Sonazoid, always we can see the grayscale change. Yeah. First we start with 50 and 50, 1, 2, 3. Usually, and we 1 to 3 times change grayscale change. Okay, we can go with 50. But 1 to 3, no change. We can increase 100. 1 to 3 change. Okay, go with 100.
One day I must come to your center and watch you.
Yes, thank you very much. Yeah.
Thank you.
Yeah, thank
So
you.
there's no more question. Thank you.